Hello and welcome to the Children's Continence Workshop delivered by the Suffolk County Council School Nursing Service. Before we start the workshop today, we'd like to go over some housekeeping and general information for you.
Some housekeeping rules. Please remain on mute during the workshop. Use the chat bar to ask questions for the live session. These questions will be themed and answered at the end of the workshop, which also goes for this session too. And the length of the session should be no longer than an hour.
Just to introduce our team and the structure of the school nursing service, we'd like to briefly explain the roles. So within the service, we have the school nurse managers, we have the school nurses. We also have the school nurse alternative provision team, also referred to as SNAP. We have community staff nurses in our team and child health screening practitioners who conduct the National Child Measurement Programme and the school entry hearing and vision screening. We have a texting service called Chat Health, which is available for young people and parents. And we have the 0 to 19 Health Business Centre, often referred to as the Hub, which is our first point of access for our referrals and incoming inquiries into our service.
I'd like just to mention confidentiality now. The school nursing team will not share any information with other services without your permission, unless there's a need to safeguard a child from harm. And obviously from the live sessions, information shared within the group will be respected and not passed on to others.
So the workshop today is the Children's Continence Workshop. And when we use the term child or children, it will be used to account for any child or young person between the ages of 5 to 19, which is what our service covers. The term continence is around the ability for a child or young person to control when they empty their bowels or urinate, so wee or poo, and it's a term that we use throughout the workshop.
So the aim of today's session is to have an understanding of continence problems in children and how you can use some simple measures to address these.
It's important to understand that wetting the bed is a really common childhood condition. It affects around 500,000 children and teenagers in the UK. And around 12% of 7 to 9-year-olds regularly wet the bed. It's important to know that it is a very common condition, but it can be treated and it's not the child's fault that it is happening.
We'd just like to focus a little bit now on the impact on the child, particularly around wetting. Quite often children feel extremely guilty. They feel it's their fault. Why am I wetting the bed when my friends don't? They can have poor appetite, which has a knock-on effect on how they perceive themselves. The poor appetite could be that they may be constipated, they feel very full, they don't want to eat. Children can feel, and young people can feel, extremely embarrassed that they wet the bed. It can make them feel dirty, it can make them feel unworthy. Low self-esteem has a knock-on effect throughout the whole of their school life and can go on to adulthood. Children and young people are really worried about having sleepovers, feel very embarrassed that their friends will know that they wet the bed. They think they're the only ones that do. School performance can have a huge impact on the child or the young person because of the continence issues. Bullying and teasing go hand in hand quite often when the child or young person wets at night. And we have found with lots of evidence that there is a link with sleep problems and wetting both day and night time.
Treating continence issues, we need to look at the order of treatment. So we need to first exclude or treat any constipation the child may be suffering. Then we need to look at treating daytime bladder symptoms and then treating any nighttime wetting. And this is because there's a very close relationship between the bladder and the bowels, and wetting can sometimes be entirely caused by constipation.
Just following on from the previous slide, we just wanted to make it more visual for parents and carers to see where the bladder and bowel are in relation to our anatomy and physiology and how close they are. So when we talk about constipation, we can enable you to realise that the bowel sits quite near to the bladder, and that's why constipation can be quite a big issue for wetting and needs to be addressed first, as the previous slide identified.
So what is constipation? And this is in our live session where we'd like you to consider, what does constipation mean to you? It's a term that health professionals will use quite often, and for you and your child it may mean something else. So just to take some time to consider what it means to you and your child when you think of the term constipation.
So constipation is considered by the terminology if a child or a young person or even an adult has not had their bowels open more than 3 times a week. We talk about bowel movements, we talk about poo for children and young people, as that's the terminology that's most appropriate for the child. If the bowel motion or the poo has become very hard and difficult to pass, then we would consider this to be constipation.
This is a picture of the Bristol stool chart, and it gives an indication of what healthy poo looks like. So we often explain this to children and young people and to parents, and it's a category of 1 to 7, and these are all different stool types and their meaning. So for the types, you know, at the beginning of the scale, so sort of 1 to 3, it's likely that there are signs of constipation, and that needs to be sort of managed and treated accordingly. Type 4 is the ideal, and that's soft and should be easy to pass for the child or young person. It's more suffering from, you know, loose stools and possibly even overflow, which we will discuss and explain in a bit more detail further on in the workshop.
So moving on to decide if your child's constipated, there's lots of considerations. As children become older, they tend to go to the bathroom on their own and close the door, and parents and carers are not aware of what's actually happening in the toilet. So quite often children may be constipated and parents and carers may not be aware of this for some time. So if a child doesn't poo at least 3 times a week, we would consider that the child is constipated. If the child's poo is often large, and when we say large, that it may block the toilet, if it's hard and difficult to push out, or their poo looks like rabbit droppings as per the chart from the previous slide, it can be an indication that the child is constipated. And as we mentioned, if the child is constipated, this can put pressure on the bladder, and this can lead to nighttime wetting and daytime wetting. Quite often, if a child has soiled their pants, it can be another sign of constipation, which just means they haven't actually emptied their bowel properly, and say the poo may be very hard. Also, if a child has runny poo on a regular basis that isn't down to an infection and may look like diarrhea, it may leak out around the hard constipated poo. So basically what we're saying is the hard poo, the constipated poo, is still in the bowel. It isn't able to be passed out because it's too hard, but we have what we call overflow, which is watery, runny poo trying to come over the sides, and we call that overflow soiling. If your child is constipated, they may find it painful to poo and may pass them blood when they have opened their bowels. So it's just looking for those aspects to decide whether your child may be constipated or not.
We're now going to look at how constipation is treated. So if you think your child may be constipated, it's important for them to be examined. Therefore, we do advise a trip to the GP. There are certain things we can be doing at home, which include physical activity. So lots of physical activity to help keep our bowels moving and healthy. Fluids are really important. So we go on later in this presentation to discuss how much we should be drinking and how much a child should be drinking. And then our food. So our diet is very important. We must try and maintain a balanced diet from foods from all the different food groups, including fruits, vegetables, fibre, and these will help to keep our bowels healthy and our poo soft.
So it's quite important to discuss with your GP or healthcare professional if you feel that your child or young person may be constipated, so that they can feel the tummy to see if they have a blockage in the bowel caused by a build-up of poo. Also, tummies can feel very distended and they can also be quite windy as well, which is an indication that they may be constipated. The poo that's sitting there in the bowel must be cleared before the constipation can be treated. So constipation is in theory a build-up of bowel motion that hasn't been able to be passed. So to clear it, the child or young person should be offered medicine via the GP, which is called a laxative. And there's an array of medications out there for children and young people. At the moment, they tend to be using Laxido or Movicol, which comes in a sachet. And it's really, really important if the GP prescribes this medication that it is mixed properly. It needs to be mixed with 62.5 mils of water, which then can be added to a juice or to a milk-based drink for the child or young person to take. It's also important to know that the symptoms of soiling and tummy ache can get worse to begin with as the bowel empties, and that the medicine should not just be given as once or twice. It needs to be given for a period of time to ensure that the bowel has been completely emptied and can then start its journey again to evacuate the bowel motion regularly.
So we're now going to move on to daytime bladder issues and enuresis. And enuresis is the medical term for bedwetting. I think we have used both terms in this presentation. So if you see the term enuresis, it does mean bedwetting.
So if your child suffers from any daytime wetting, then we would ask you to speak to your GP in the first instance. And what we mean by daytime wetting is if they've got what we call urgency, when they're having to rush to the toilet and can't hold, or frequency, if they're going more than 7 times in the day. It's important to get the GP to see and advise on that issue. The GP will examine your child possibly, and their urine may need to be tested to ensure that there's no urinary tract infection.
So for children and young people with continence issues, it's important to understand the function of the bladder and bladder capacity. So we explain to parents and carers that the bladder is a muscle and it is like a balloon. It stretches when it fills and it shrinks when it empties. And the idea is the more you fill the bladder, the more it can stretch and then the more it can hold. So that comes into play when we talk about bedwetting. Ideally, we want the bladder to be holding, a good amount of fluid overnight. So it's important that the bladder is a muscle and it gets worked throughout the day by drinking plenty and weeing, so it stretches and empties frequently. Children should be going for a wee between 4 to 7 times a day, and there are ways that can help support a child during, at home or when they're at school, to encourage them to do this.
This next slide just shows us a reward chart, a toileting reward chart. So basically what we're suggesting is that the child or young person can devise their own chart, or at the end of this presentation you will see some signposting where you'll be able to download free charts if you wish, just to enable the child or young person to take a little bit of ownership around their regular drinking and their regular toileting. So they can adapt this chart to how they would like to fill it in. So we would look at, say, maybe doing just every 2 hours going to the toilet, so they could draw a little picture or put a little star, just so that they're maintaining some ownership. So reward for actually going to the toilet regularly, not actually because they've been dry at night, if they have a nighttime wetting issue, because they can't help wetting at night. So this is all around them taking ownership about their regular drinking and regular toileting.
Right, so the next couple of slides are on drinking, and as I've already mentioned, fluids help the bladder to fill up and stretch so that it can hold more and stay healthy. We encourage children to have at least 6 to 8 drinks a day, preferably of water or water-based drinks like well diluted fruit juice or squash. A glass of milk is fine, and it is considered to be part of a balanced diet, but we shouldn't include it in the overall fluid kind of quantity for the day. Drinks should be spread out evenly throughout the day as well.
So the size of the drink will vary depending on the child or young person's age. So we've just put some mils to cup sizes just to make it a little bit easier for you. So 150 to 175 ml cup for a 4 to 5 year old is what we would be expecting them to drink on a regular basis. 200 mils for a 7-year-old and 250 mils for an 11-year-old in the size of cup. We would strongly recommend that if possible to avoid drinks that contain caffeine, so things like tea, coffee, hot chocolate, things that irritate the bladder such as blackcurrant, sweetened and fizzy drinks and flavoured water. It's really important that we have the children and young people drinking regularly, so if they will only drink a dark coloured drink, then we'd strongly recommend that every time you make the drink that it becomes more and more dilute. One way to measure out drinks for children and young people is to fill up a jug in the morning with the amount of fluid that is recommended for them to drink throughout the day, and that often encourages the children to realise, oh gosh, I need to have another drink, and it can be a very useful tool. The little table on the bottom is the evidence-based criteria for the amount that children and young people should drink throughout the day, and it is quite a useful tool. And again, it's getting the child or the young person to help you possibly fill up that jug, possibly to help add less juice to their drink. So water is best if possible, but we need them to drink regularly throughout the day.
So we've included a picture of a drinking reward chart that is available for parents and carers to download and print off yourselves via the ERIC website, which we've included at the end of this presentation. And as we've already mentioned, it can be really helpful if you could fill up a jug of the required amount of fluid for your child, and then encourage the child to colour in, say, each square, or tick off each square at certain times when they've finished that drink, until they've coloured in all the required cups or squares for that day. And then it's great to reward for the end of the day if all the cups are coloured in, and try to reward behaviour of drinking rather than the child staying dry themselves.
So just some other guidance that we'd like to add in. So when your child or your young person is going up to bed, what we'd recommend is when they're getting ready for bed, putting their pyjamas on, that they go for a wee at that point. What we would encourage at each time a child goes for a wee is trying to encourage them to stay there a little bit longer. If they think they finished their wee, they might just stay there and count to 20. So basically not to force any wee out, but to help allow that bladder muscle to relax. And if there's any more wee in there, that they're actually emptying their bladders fully. So as I say, if they can go for a wee when they're brushing their teeth and getting ready for bed, and then literally just before they're about to go to sleep, is again trying to encourage them to get out of bed and go for another wee. And that's what we call double voiding. So it just means that we're allowing the bladder to empty, so the bladder is completely empty before they go to sleep. For a lot of children, they can be quite scared of the dark. So if possible, have a night light. So that can help them see where they need to go if they wake up in the night, or to have a torch next to their bed, because sometimes that can help, particularly if the toilet's downstairs or at the other side of the house. Ensure that they've got easy access to the toilet if possible, and also just being mindful of the type of bed that they're sleeping in. If they're sleeping on a top bunk, if possible, if the mattress could be put on the floor just while you're going through the toileting process, that can sometimes be helpful. And obviously where the toilet's located. So for example, if the toilet's downstairs, you might want to have a portable toilet in the bedroom just while you're going through this toileting programme.
Some further advice is to, if possible, try to stop the child or young person wearing pull-ups or nappies. Ideally, if you could use protective covers or bed mats instead, that can help the child to remember when they go to bed at night that, you know, they're not in a pull-up or a nappy, so they do require, you know, to, if they need a wee, to get up. It can sometimes help prompt them, and, you know, can help them when they go to sleep at night knowing that they're not in the security of a pull-up. So that can help kind of aid the toileting and process. We like to encourage children and young people to help parents or carers with changing the sheets and bedding if they do wet, and this can be rewarded as well. If they are thirsty, they can have a small cup of ideally water just before, an hour before bed, but no further drink after that. And try to ensure you have consistencies of your routines and that you keep them wherever your child is. Bedtime routines are really important when it comes to toileting, and, you know, sleep, as we've already mentioned, can be affected by bedwetting. So try to think positive thoughts with your child, encourage them to think positively, and try to enable them to have a can-do attitude.
And again, we just like to revisit the reward system. So it can be really helpful to reward behaviour rather than dry nights. So for example, when we talked about the charts in the previous slides, is drinking plenty of fluid regularly throughout the day. So marking those off on a reward chart can be really, really helpful. Using the toilet at regular intervals so that they're actually emptying that bladder really effectively throughout the day. If they've been prescribed any medication by the GP, making sure that they're taking that regularly and rewarding that regularity. And helping to change the sheets at night time just means that they can help remake their beds, get back into bed much quicker and go back off to sleep. So it's really important to be rewarding the behaviours rather than the dry nights.
Further to that, we advise that you do not use systems that remove any previously gained rewards, and this is mainly because, you know, Bedwetting or soiling or daytime accidents are beyond the child's control, and we don't want to increase any kind of feelings of guilt or low self-esteem that we've already discussed in the beginning of this presentation.
Lots of families lift their children at night time to take them to the toilet, but this is managing the bedwetting rather than curing it. And what we mean by this is that they're not actually fully awake when you've lifted them to take them to the toilet. Quite often, if you ask a child or a young person, did they remember going to the toilet in the night? They will often say no, they didn't. It will help to get a dry bed by lifting the child at night rather than a dry child, as you are deciding when they should do a wee rather than them responding to their own full bladder signals. So lifting can be helpful when a child first stops wearing nappies at night. However, if you do lift them, you need to make sure you put the light on and that the child is fully awake. And as I say, quite often you may feel they are fully awake, but if you ask them in the morning, they tend to not remember that at all. So lifting is probably not an option that we would recommend at this point.
Thank you very much for attending the workshop today. There's some contact numbers for our service, including the Health Business Centre and the Chat Health text messaging service. We have got another slide further to this with references and useful links for parents and carers to support you with continence needs and issues for children and young people.